Hi guys, my name is Ngozi. I'm a registered nurse. I've practiced in Nigeria for 7 years. I'm currently practicing in the UK. So one of the things that I like to do is to talk about nursing advancements, give tips to nurses for growth and career development. I've talked about using the pre-registration master's route to becoming a nurse in the UK. And I got so many questions about, how it is possible, why this route is a thing at all, and so many reactions to it. In this video, I'll talk about the benefits of using this route to become a nurse in the UK. Now, I've actually had a guest who came to talk about this pathway and how she navigated it. Today, she's a nurse. She has actually taken the NCLEX exam as a nurse, and the sky is just her starting point in nursing, if you ask me. You can actually go and watch that video so that you understand where I'm coming from. In this video, I have jotted down all the juicy points and all the amazing benefits of using this route based on our conversations and the first-hand experience of my guest in that video. Okay, make sure that you watch that video and then let us get into this right now. So the first advantage of doing the pre-registration MSc adult nursing or mental health nursing is that you can actually come from any profession at all. So you can switch from your discipline into nursing through this route. So you don't have to become a nurse first. You just have to have your BSc degree. And you can use your BSc degree to apply to become a nurse in the UK. The second advantage is that you actually need a 2-2 and above. So there's so many schools that will accept a 2-2 as your qualification from your BSc degree. They will accept a 2-2 and you can use that to apply into this master's program. So that is amazing. So you don't have to worry if you graduated with a 2-2. The third benefit is that this route takes 2 years for you to study. So unlike the typical BSc route or diploma route where you have to study for 3 to 4 years before you become a nurse, now you have to just study for 2 years at a master's degree level. You graduate as a master's degree holder. Okay, so that's another benefit of utilizing this route to becoming a registered nurse in the UK. Not all schools require that you take an English exam. So for some of these schools, you don't have to write IELTS or, OET, TOEFL and all of that. You just have to prove that you've studied in English at your BSc level, and that's all you need to get into the program. The fourth benefit is that you can actually pay tuition in installments. All right. So there's so many payment plans that these schools offer. You have to do your proper research to see which one suits you better. The good thing is that with that instrumental payment, it's actually a chilled and a relaxed way of making up for your tuition throughout that 2 years of studies. Another thing that fascinated me based on the conversations that I had with my guests concerning pre-registration MSc adult nursing is that there is actually an opportunity for you to get a waiver. And when I say a waiver, it's a waiver on your tuition based on how well you have done with your BSc. So let me give you an example. So Chisom, who I interviewed regarding this route, she actually mentioned that she was given a £5,000 waiver off her tuition fee because of her first class degree. Okay, so if you have a first class, you actually have an edge here. So there's actually an advantage that you can maximize. So you need to do your research to know which schools can actually give you opportunities like this. I think it's an amazing thing, honestly. Another advantage is that you would have 20 hours to work as a student in the UK, and this applies fully to this program as well. So you have 20 hours per week to work and generate some, funds for yourself. So that's a good thing. The next good thing is that you can actually apply for a post-study visa after studying, and then you have about 18 months to 2 years to be in the UK. You can work and utilize your license and all of that. Another advantage is that you get to register with the NMC UK seamlessly and directly. You don't have to write any further exam. You just have to finish your studies, pass everything that you need to pass, submit everything that you owe to the school, and then the school informs the NMC UK that you are actually done with your studies, and they just give you a pin. How amazing is that? If you're already a practicing nurse with a BSc, you can actually still do this pre-registration MSc in adult nursing or mental health nursing and come out to become a registered nurse in the UK. All right, so that is a very good advantage. Nurses who are actually trying to migrate to the UK can actually utilize this pathway as a way to get their MSc degree and also become registered nurses with their PIN in the UK. The next thing I'm going to talk about is the fact that you can start working immediately you get your PIN, okay? So most people, even 6 months towards graduation, they're already job hunting and they already landed jobs as band 5 nurses in the NHS and, you know, in different sectors. And that is just so amazing. I mean, the job security attached to it is top notch. And lastly, I'm going to talk about the fact that doing this program does not limit you in terms of working in the US, in Australia, or in Canada. You can actually decide to migrate as a registered nurse. You can take the NCLEX exam. So these are the perks of doing this program. Now, let me add here that nursing at whatever level is not cheap. It's not easy. It's not a walk in the park. You have to work for it. You have to study hard to get your degree. With this program as well, it's like an accelerated program that aims to bring professionals into this profession that is nursing. So you will actually have to do the work that is attached to it for you to get that degree. I'm wishing everyone who is deciding to take this pathway success on their journeys. I'm hoping that you have a smooth ride, and I'll be happy to welcome you into the profession once you are done. And let me add that there are other professions within the healthcare that you can actually do a pre-registration master's in. For example, speech and language therapists, physiotherapy, dietitian, and so many more. You just need to do your research very well and choose which is very, very suitable for you. If you haven't liked this video and shared it by now, it's like we're going to wear one trouser. So share this video with someone who needs it. Make sure that you like and follow, subscribe as well, and I will see you in my next video.